I don't know if the gravy.
2025 meeting of the Rush Town Board. Please join me for the Pledge of Allegiance. Pledge allegiance to the flag, United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And that we would call the roll, please.
Person Kai,
Here.
Councilperson Tate,
Here.
President Williver,
Here.
Councilperson Kelly,
Here.
Councilperson Brown,
Here.
I have no announcements today. The executive session is going to be held after the meeting to discuss personnel matters.
It'll be
The end of the meeting, sorry. Public comment period. Anyone wishes to speak, please. 3 minutes.
Good evening, everybody. My name is Kelsey. I'm a resident on Middle Road. For the past 3 months, so this is the third consecutive month where I've stood here to discuss concerns about the quality of our meeting minutes. If you take a look at our agenda tonight, it says town board workshop, or sorry, regular meeting Wednesday, September 24th, approval of minutes. I looked online in the normal spots that we normally have our meeting minutes, and those minutes don't exist. So they weren't posted within the 2-week period that they're supposed to be posted. I sincerely hope that you guys got a copy of the minutes and were able to review them before we vote to approve them this evening. If not, then I urge you not to move forward to approve them. You know, and I'm looking at sort of the history of the last 3 months that I've been up here to talk about this. It's concerning because it's the second time that we've seen a violation of the open meeting laws. So there was the first time, I think it was back in early August, where on the agenda, there was not a posted vote when the tax assessor's term was going to be extended. So citizens didn't know that that was going to be talked about in that meeting. And tonight is another point where we're violating open meetings law by not having those meeting minutes posted to the public within 2 weeks. This should concern everybody in the room that we're violating the open meetings law, right? Everybody deserves access to the information, including the citizens here, as well as the board. On behalf of everybody in the room, I'm demanding better. Thank you. Hope you guys have a great evening.
Thank you.
Catherine Hankins, 2353 Pinnacle Road. I attended the budget workshop on Monday, and it came up about the supervisor's salary, and it was commented that our town is not like other towns, that if there was some evidence to show that our town, that our finance director had perhaps erred in terms of her benchmarking. So I looked, because we're, at least in our marketing, we're a rural residential community, trying to be a right to farm community. So I compared ourselves to Avon, Caledonia, Wheatland, Hamlin, Parma, Riga, and Rush. The other was that there was an assumption that they all must be retirees and they don't need the income. Dan is the oldest of the group. The third was that it must be the complexity of our town. Not only are we the smallest, not only do we have the fewest parcels, not only do we have the fewest acres of agriculture, we are not anywhere as complex as these other towns. Riga, 5,586 people. Parma, 16,127 people. So I printed this out because I know I only have 3 minutes, and I have one more issue, which is I was looking for the agenda, which is almost impossible to find now because the website has been so compromised, because we have never had any political messages on our website. Jerry Cusi only said, "Welcome to the website." This is a website that was designed to be a service center. Find your agenda with one punch. Why? Because I'm an ADA, Americans with Disabilities Act specialist. I have been trained with it. I've got 30 credits from the University of Missouri. So I worked with specialists. We had a state-of-the-art website. Now you can't find anything. Why? Because they've taken it all out. Can't find the assessment roll. You can't find the budgets. You can't find anything unless you're a detective like me. So I did read what was posted by, again, the supervisor. And I never really got through the whole thing, but I saw that the town of Rush recently purchased a 5-year-old truck for the highway department to replace the 15-year-old truck previously used. I searched all of our minutes, could not find anything, and I know we have never bought a used truck to replace a used truck. Can't find it, but I did find that the board had approved in January of 2025, $58,000 for a pickup truck. And I found that in August, a truck was paid for that had been approved previously. That's all I could find for 2025.
Minutes are up,
I understand that.
And you have,
I-
if you have anything further to say.
I'm gonna
you can
get these
email-
papers and I understand that. And you're, I'm fine, but if you, what are you gonna do? Arrest me? So I'm finished and I'm gonna give you these papers, but I hope you keep your word and go back this afternoon after this meeting and start to make sure that you make adjustments, not only in these salaries, but we can find all of this information. It does not have to be in an executive session. It's in the state of New York payrolls. So that would be something that all of you should look at. And when you have so few people who are willing to take not just a little time, but hours to do the work that the town finance director should do, you should be thanking me, not having me have to go and beg for a minute. That's so wrong. So $58,000, I only have one because my printer stopped. But I do have what was on the website. And I want an answer to this because this is a very serious matter that there is no resolution that I can find because in the past, Mark David bought trucks and in the same resolution was what we were going to do to dispose of the old truck. And I can give you all of that information because I have it all.
Your minutes were up.
Yeah, I'm delivering the papers and I can talk while I'm delivering them, you know. We're either a small town or we're trying to be something we're not.
Thank you.
I can't really say thank you.
Anyone else?
Here we are. Second time this week. Nice to be with you all again. Sorry. Yeah, Mary Ellen Heyman, Middle Road. I do find the jumping up at the 3 minutes kind of stressful because, you know, I appreciate hearing the little bell. When I hear the little bell, I'll wrap up my thoughts and I'll be out of here because I don't want to talk more. I did want to mention, and talk a little bit about perception versus reality, which is sometimes we all perceive that everything's fine and that what we're doing is great and that we're really only trying to do the best for the citizens that we are representing. However, the reality is that healthcare has always been a problem and it continues to be a problem and it will continue to be a problem. Can anybody hear me?
I don't think that's on, is it?
I don't know if it's on. Is it
No
on?
green
I
light.
sound the same. I think I feel like I sound the same. I can talk louder.
Yes, it's.
Health insurance is a problem. And the reason I say that is because we all know, those of us that work in private sector, not in government, that every year your boss gives you, this is what we're gonna offer you, pick one. There's no discussion. And this is what you're going to spend and there's no discussion. And now, even for myself, on Medicare, the boss, whoever's deciding about Medicare, sends out notes, sends you maybe 6 groups that you can pick from, and this is what they're gonna pay, and the rest is your problem. So when I listen to the discussion about healthcare, certainly not telling you what to do, because you all have to vote your conscience. But what I'm saying is that perception and reality are 2 different things. And I wouldn't want to be on the other end of the question that says, why have you spent so much money on something that really could be shared in a shared environment? Because that's how we all live. So anyway, thank you for listening to me about that. And good luck with tonight and the deliberations. And I appreciated the time that I've been able to get up here and talk to you guys because I think what I have to say is important and I appreciate that you listen. And that's what and why we're here in America. So thank you very much.
Thank you. Anyone else?
David McGlashan, April Lane. Couple things I wanted to raise concerns on. I also went to the workshop this week. One, it wasn't posted on YouTube. It would be nice if I saw the little owl thing recording. If we could at least get audio or something so that citizens can hear the discussion that went on that. Also looking at some of the numbers that were referenced, like social security raises and things, like saying that 3.2 was that amount. If you look, it's going to be raised 2.7%. So if you want to look at the adjustment, and as a teacher, that's like what we get to. So do school districts kind of follow that as well, another public entity. Also in regards to the LED lights, it looks like that's about a 50% savings if you wanted to look back at that energy cost. And finally, I just thought it was a little bit alarming to see that it almost seems like political motivated statements are being used on our town website. There's very few numbers put up there. Like I saw the 2018 budget is referenced. I don't know if that's the budget that's being used this year for planning purposes. That was confusing. But if you want to show all of 2018, maybe all those numbers should be covered on there versus just selective ones with 2025. And yeah, I think maybe we should be talking more about 2026 versus 2025, not 2018, 2023, 2025, because all that kind of confuses people. And then it almost seems like certain people were blamed in that. And also looking at the newsletter, it was a really nice kind of political advertisement at the end. I don't know if you can place an ad at the end of it or something, but I haven't seen other towns. I received the Henrietta newsletter. They don't do that in their newsletter. And I also have seen the Mendon one as well. But to kind of really promote the elected officials on the last page, I didn't see thanking every worker in the town. If we were thanking all the workers, I could see that. But just alarming because I know that's against the law to use a public entity for a political motivation. So thank you.
Thank you. Couple minutes before the presentation. The minutes apparently didn't get posted, so we can't vote on those for the regular.
So what happened, and we reached out to, E-code, and GoGov to the GoGov people. So it was either a, John had got a phishing scam and it corrupted his computer. So we don't know if that affected the website, but the website was at 4:15 today. It was up and running, and there is an issue with getting the workshop posted because of the phishing scam that happened. So we are working on that. Pam tried 3 times, and we're going to try again tomorrow morning.
Okay. Thank you.
And by the way, I just heard that we're not on YouTube right now.
Try again on YouTube and it's not. But I can download the Zoom meeting tomorrow and it will be on there for people to see this meeting.
We got, seriously, this is just not acceptable.
It is recording, please record.
We could approve the board minutes for the workshop. Of September 30th. Yep.
I move to approve town board workshop meeting minutes of Tuesday, September 30th, 2025, as submitted by Deputy Town Clerk Buchanan. Do I have a second?
I'll second. Aye.
Okay,
Aye.
Supervisor Williver,
Aye.
Riley,
a reluctant aye
Councilor-
because they were grossly misleading, I think. And certainly not enough. There's minutes, one paragraph for a 3-hour meeting. You tell me how we did that and you're not, and you think you're capturing the gist of what we talked about is so wrong. And I will say it again, this board, let me take back my vote. I'm not, I rescind my vote. I'm sorry, I just can't because it's just not right. It's just not right. Sorry, no, nay,
Apologize.
yeah.
You're good. Aye. All right, now we have a presentation from Melissa Wayland, Director of Strategic Innovation at Common Ground Health regarding age-friendly municipal focus.
Thanks. Hi, everybody. If I don't use the speaker, can you hear me okay?
The mic can come out of there. You can,
That would be great.
Just for the. Or I can move this, you want me to bring this right over for her then? Is that fine?
She won't be in the, she won't be in the, she won't be in the camera though. If she knows that.
But you can hear it, right? It's up here. Okay, we good?
Yeah, it's fine with me. Can everybody hear me okay? Is that better?
Yeah.
Okay, thanks. So thanks for giving me about 15 minutes on the agenda tonight. I'm Melissa Wendland. I am leading the Monroe County Aging Alliance. And I want to talk a little bit about the Alliance, what we're doing in communities throughout the county. And I'm not going to sell you anything. I'm not going to ask you to do anything. I'm trying to create some awareness that we have a significant older adult population in our county. About 30% are 60 and older. Tomorrow is National Ageism Day, which takes a moment to reflect on those 60 and older to recognize the value that they bring to our communities. Fundamentally, they're your taxpayers, they're your voters, they're the community fabric, folks that have been here for generations. There's a lot of intergenerational opportunity with older adults, and we want to celebrate them. And we want to also consider them as we move forward in our planning process. So I'm just going to forward this really quickly. So the Alliance is a group of organizations throughout Monroe County. And the goal is for us to work together to try to support older adults' needs. And I think that's more important now than ever as we have an aging population. You'll see that there's a variety of organizations that are up there. Some might be familiar to you. They're community-based organizations, they're hospitals, they're educators, they're researchers. And we're working together to support older adults for probably the last 15 years. Because of our work together, we are designated as an age-friendly, livable community by AARP. So what that means is that our county executive supports municipalities working together to try to figure out what is most important to older adults as they age and how to support them within communities. So I want to share just a little bit about what an age-friendly livable community is. So first, let's just break it down. What is livable? It means that anyone, any age, if you have a disability or not, you are safe, comfortable, and included in your community. So all are welcome. If you talk about age-friendly, again, it's every age from birth until you take your last breath. And so there's a picture here on Charlotte Beach with a blue mat. And what it's showing you is a mother with young children who can push a stroller on the sand. If that mat wasn't there, she would not have access to the water. It would sink in the sand. The same thing happens if you're bound to a wheelchair, if you are required to use assistive devices. And so what we're saying is as we're thinking about access for all, we want to make sure that we're thinking about the nuances of our community, particularly older adults. Things like lighting, things like font size, the color, being able to walk across the street in a timely manner before the light changes. Things that just continue to say, we recognize you're part of our community, we respect you're part of our community, and we want you to continue to contribute to our community. So here's just a couple of examples of age-friendly, livable community. Access to fresh fruits. We're really, really fortunate. Our community is very accessible and age-friendly. We are rural and we're small, but we still have accessibility to a lot of things that folks in urban populations don't. Here's a couple of examples. When we think about planning, when we think about buildings, when we think about sidewalks, when we think about streets, we want to make sure that we're looking at how can older adults access, as well as young families or families that have multi-generational older adults and young children. So why is this important? Well, you can see on the map, the demographics, we're an aging community. Okay, so basically what happened is the organization that I worked for 20 years ago started a commission on looking how to support older adults by the year 2020. We've passed that. We've gone through a pandemic, and we've learned a lot about the needs of older adults during that pandemic. Concerns about social isolation, concerns about access to food if they don't have family close by and they're relying on other services. Accessibility has been a huge, huge consideration. What's happening is we're starting to see that the older population is exceeding the younger population, which means in the next 10 to 15 years, we're going to have more older adults who are taking care of each other and older adults than we are young families. The other demographic is if you look at our families, typically in communities 40 and 50 years ago, neighborhoods took care of each other. When you're in a rural community, just having access to neighbors can be more difficult because we've got farmland. The other consideration is many families now, children leave and raise families in other communities. So we're finding that we don't have as much of our younger generation here to support older adults as their needs increase. Typically what happens is everybody's good until they're not. And that's usually around age 75. 75 is when we start to see the pieces and parts need some repair, just like a house or a car. And so what happens is that's when there's more of a reliance on services, friends, informal caregivers. And so we're talking with municipalities throughout the county to say, how are communities planning for older adults in the next 10 and 15 years? Everybody's required to have a community service plan. Any guesses out of 20 municipalities, how many counties actually include age-friendly considerations as part of their comprehensive plan? We got one in July. The town board passed a resolution because I went and had a conversation with them. We talked about their aging demographic, and they said, as we look to the future, we want to include thinking about older adults. And they actually made a resolution that said, any decision we make, we think about how does it impact families? How does it impact older adults? Creating that awareness will help us in anticipation and preparation of what's to come in the next 10 to 15 years. So, I think that, I talked a little bit about already over 60, we're the tax base, we're the voters, we're the people that have been born and raised here. Fundamentally, what we really want to do is say that ideally, there's ways that we can include age-friendly planning in our communities. I just did a webinar with AARP. It was across the country, and it was talking about what communities prioritize when they look specifically at work that they're already doing and how they can enhance that by looking at what they're doing for older adults. So specifically, if there is buildings in the work to support older adult housing, Are they doing single step entrance? Are they doing zero entrance for showers? Are they including shower bars so that you have access to just support yourself? Is the lighting adequate? Are there sidewalks that are available? And if not, what are we doing on our roads to create space for older adults to stay mobile and to stay inclusive and active so that they can still access resources? So this slide shows a little bit of some of the things that are important. One of the key things that I really want to talk about is the need to support older adults from isolation. What are we doing to support our community so that they don't get alone and we don't even realize that they might be isolated? Something really neat is happening down the road that I'm going to tell you about. So there's a livability index by AARP. Anybody can go to this website. You can hold your phone up and you can scan. And what it does is it shows you what's included in a livability index. And they talk about housing, transportation, access to food, engagement within the community, opportunity to have your voice heard. And what they do is they rate communities based on how active they're participating in the criteria that they've developed. This is completely transparent. AARP is the biggest advocacy organization for older adults. They want to try to support what's going to come in the next 10 to 15 years, which fundamentally is we're seeing a lot more older adults that are struggling economically. And how are we going to support them as a community? So you'll see this livability index. And here's what's really neat. If you look at Rush, it's got a 50. Now, this isn't out of 100. If you look at Monroe County, the entire county is 57, which means there are some communities that are lower than 50, and there are some communities that are higher than 50. Rush is right about in the middle. And as I said, there's some really good things that are already underway. That's not the case in every community. So there's a willingness to embrace older adults, a willingness to recognize their contribution, and a willingness to continue to try to support, accommodate, and include them. So I just want to say really quickly, there's a timeline here. This is not new. Okay, we've been talking about this across the globe for the last 15 years. The World Health Organization started talking about it. Then AARP started talking about it. Then our governor started talking about it. And most of you might recall that we became the first age-friendly state in the country. The governor recognized that we are one of the oldest aging states in the country. And because of that, a policy was passed to say health across all policies needs to consider older adults. So whenever there's any policy recommendations to the state, and I do that as part of my job, it's inclusive for rural or urban or suburban older adults. I just convened a summit across the entire state for rural communities. We came out with a policy report, recommendations with our governor, with policymakers, with legislators, with senators to talk about how are we taking care of our parents, our grandparents, and our neighbors as we continue to become an aging community. So what's really nice is the state just passed a master plan for aging. We worked on it for 3 years. The recommendations are now coming down to policy and funding. The state recognizes that we need to support our own communities, and there's recommendations in how to do that. So I think what's most important for you is there's a website, Monroe County Aging Alliance. It's part of the county website, but the Aging Alliance actually has its own website. There are reports on there about what's included in an age-friendly community. We made recommendations 8 years ago to incorporate 96 action items. 74% of those action items have been enacted. Now what we're doing is what we're calling 2.0. we're bringing all of those considerations to each municipality to say, what in your comprehensive plan could include age-friendly considerations? So here's what I've been doing since basically January. I have been meeting with municipalities talking about age-friendly livable communities. We did a training in March for 85 people throughout the county that are town planners, zoning, climate, environment, to come to a 4-hour workshop, get continuing education units, and talk about what is an age-friendly community. And I think a lot of times people think it's like, okay, we have to change our roadways. No, 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 no. It's what are we doing already that can enhance supporting older adults? Do we have a bench outside so that if somebody's out for a walk, that they can sit down and take a break, that they can socialize? When we plant trees, are we thinking about shade as well as sun? When people are active or where they're coming to areas in the community where they come together and socialize. Very simple, straightforward things. Again, that's part of what's in that livability index. Completely transparent, completely available to all. So the other thing that I've been doing is I conducted a questionnaire across the county asking folks 50 and older, what's important to you? And now I'm conducting focus groups. I'm actually meeting with older adults and communities saying, I don't know if you filled out the questionnaire or not, but I'd like to hear from you. This is what we heard. Is there anything else that you'd like to share, that you'd like to offer to us? Well, what was really neat is Rush Henrietta School contacted us and said, we'd like to host a day for older adults. We have a need for educators and for support in schools. And we would love to engage folks that aren't working that want to work. We'd love to hire them. We'd love to train them. So we spent 3 weeks, that's it, 3 weeks on a campaign to say, if you're interested, come to an open house. Let's talk about all of the open positions that are available. Let's talk about how it can accommodate your schedule. It doesn't have to be every week, could be a couple months out of the year. And figure out if there's an opportunity for you to contribute to the community and for us to engage you because of your expertise and your insights. 30 people showed up within 3 weeks of advertising. They've now asked me to come back and conduct a focus group. So what I want to say to you is there is a focus group that is scheduled next Friday, and I will send the information to our town clerk so that if you're interested, this is an open opportunity for anybody to come and have a discussion with older adults in the community to talk about what you like, what you'd like to see continue, what you'd like to see happen as a potential down the road opportunity for planning, and helping to inform community residents about what's important to you. Okay, so opportunity to hear from you. I'm going to send information. I'll actually tell you before I leave, and we can announce it before I go where it is, when it is. And fundamentally, I'm asking all of the town boards to give 3 considerations. Number 1, time on a board meeting, which has happened. Thank you very much. Appreciate it. Number 2, information about a focus group, which I'll leave with you. Would love to hear from anybody that's 50 and older. And number 3, if there's an opportunity to pass a resolution as it relates to age-friendly, I have a document that is a draft document. People can modify the language any way they want that says, here's what we've got in the works. Transportation has been a big consideration. Things are already underway. Housing, things are already underway. What are other things that we're working on that could incorporate older adults for consideration? And so I will, again, leave that resolution. And if it's something that the board is interested in, I will be ending this project in December. And we will be working on a lot more advocacy for older adults. So my information is available. I'd love to hear from all of you. It's on the website. It's available. I think I've got presentation. Here's some resources, which all will have access to. And you can get my information on the website as well. Thank you for your time. Thanks for your consideration. And I hope tomorrow you celebrate one person that's older and recognize the value and contributions that they bring to our community. Thanks very much.
Thank you.
Thank you.
Read any of, there were a few things I was able to see on that screen.
Yeah.
But mostly I was not. So as an aged person.
Yeah. Yeah, you should have had a full screen and you didn't. So here's what I'd like to offer you. My phone number and my email are available to all of you. So if you want to take down a note right now and you send me your email, I will send you the PowerPoint presentation. The town's already got it. So it's Melissa, MELISSA .Wendland. It's big at commongroundhealth.org. If you'd rather just use my phone number, it's 585-455-8497. For the record, it's available, it's public. We are here for you. That's why I'm coming to these meetings. If you can't find me, the town clerk knows how to find me. Does that help? Thank you. I appreciate your attention. Thanks, everybody.
Thank you.
Thanks very much. Thanks for the chair, guys.
Moving on to the approval of the abstract.
I so move, having reviewed all vouchers on abstract 5-2 of October 8, 2025, authorized payments totaling $22,852.84, which includes Fund AA General for $17,096.87, DA Highway Townwide for $5,221.83, and Fund LL Library for $534.14. Do I have a second?
I'll second it.
Aye.
Aye.
Steve,
Aye.
Supervisor Boulder,
Aye.
Aye.
Councilperson Brown,
Aye.
Report of officers, Deputy Supervisor Chase.
The only thing I have to report is, I attended the budget workshop this past Monday.
Councilperson Morelli.
Yeah, quite a few things, actually. Let me get myself organized here. Okay, so on September 27th, I went to the Rush Fall Festival. It was a beautiful day, absolutely beautiful, and I thank everybody who worked on that and volunteered their time, and it was an outstanding event in the town of Rush. On September 30th, I attended a town board workshop on residential codes, which is still ongoing, people, for the, I don't know how many times, 3, 4, what are you on, 4 now? Three workshops, and we're not done. A lot of controversy in my mind. I encourage our town board to, let's set a meeting like for next Monday or Tuesday and keep going and get this stuff resolved. I encourage the public to be very aware and tuned into these discussions because it could affect how you live in this town. So please pay attention to when we do it and let us know what you think. And this past Monday, I attended the town board budget workshop. Again, another lively spirited discussion at times. Not resolved. We're not done. We are not done. There's questions. And honestly, I see there's some stuff on the agenda tonight that we have no business discussing. But other than that, I went to a meeting today with Supervisor Willover. Todd Nobby from Invenergy came to meet with us to give us an update. He's been very willing and open, I think, and transparent and answering all our questions, I believe.
Yeah.
At any rate, he wanted to give us an update. Schedules are changing with regard to the development here. There's 5 different phases, tree clearing, a series of hole boring, which I'll discuss a little bit because that's the one that's changing. And then it goes into major civil mobilization, which involves the full crews where they're going to work on access roads and grading, and which will lead into, the pile driving and the electric placement. Then comes this high voltage phase where they are connecting to the substation, and then they have the post-construction phase. They expect the panels, again, I may have said this last time, but he reiterated the panels to arrive in the second quarter of 2028. Pile driving to commence in the summer of 2027. But the thing that's changing right now has to do with the boring of holes under the Genesee River. Yes, under. And it's very interesting, and we saw lots of maps, and it was very, very interesting. We asked lots of questions. So that phase was originally, and I didn't have time to type up my notes. This was just today, and it ended at what, 5 o'clock? I don't know.
Yeah.
Got home, eat, got back. Anyway, so that was originally supposed to start in April of 2027. But they have a subcontractor that is ready now. It's a good time for them, apparently. And they are hoping to start this boring of these holes this November, like in a month and a half from now, towards the end of November. And we asked about that. So the setup and all the trucks and equipment are going to it's going to start on the Caledonia side, on the west side of the Genesee River. Because on the east side of the Genesee River, there's, and I don't have a map of the proposed, this whole project, but on the east side of the Genesee River, where the power is going to be connected on this side and at Gola substation, but they have to come across the Genesee or under it, and they're going to bore 60 feet below the riverbed, way down, and then they're going to come back up gradually on an incline, if you follow me, but because the field adjacent to where right where they're coming through is restricted because of the artifacts, all the Indian artifacts that are there. So it's a very protected area, and that changed the whole footprint of what they were originally planning to do here in the town of Rush, because they're going to put the panels and everything north of there. So this is a whole protected area. So they're not going to come back up. They're going to continue their boring way under, and they're going to be at this point 70 feet below the surface of that field to come through with those lines, go under the railroad tracks. There's railroads over there on the west side going north-south, and they go under there, then it will pop up. So they're hoping to bore 7 8-inch diameter conduits through and approximately 18 inches or 18 feet apart or 18 inches apart.
18 feet.
18 feet apart. Okay, that makes a difference.
Yeah.
So it's a big project. It's pretty involved, and it was quite interesting, but at any rate, that's going to possibly start this fall, late fall. So we'll see. And it doesn't necessarily accelerate any other part of this whole project. There's just an opportunity for them
That's what
to
they're
get this part
The
done. Yeah.
contract.
So they're still, have to get permission from ORIS. That's the Office of Renewable and whatever, energy siting. I knew I'd get it out, but thanks. So anyway, they're doing that. The permit with ORIS does require them to have a pre-construction meeting with the town. So that may happen in early November. We'll fill you in with, we're gonna have another conference call in 2 weeks
Yes.
to get firmer dates on this. Notices will be sent to residences within 1 mile of this, but we would hope, and I asked the supervisor, and I asked them to get us maps and stuff, so we could post that,
Yeah.
so you can look up where you're at, in relation to this construction that's going to start. So what you could start seeing things over there, and some of you people here live in the neighborhood. So, and they're shooting for a presentation to the town, possibly in early November, but we hope to have more concrete updates as we continue our discussions with them.
Yep.
So, did I leave anything out?
Currently, we're planning for every 2 weeks, we'll have a meeting with him for updates through through the whole project, which keep us informed.
Yeah.
That's
But
it.
I think that's it. I think that's it. He did mention that he does welcome Janet Glocker and Amber Corbin to call him anytime. He said this specifically.
Yep.
The conversations and the questions that you guys ask. And they, of course, are working with Councilperson Luther Kais here to, as a group to keep Luther involved. So. What?
Thank you.
Yeah.
I'm just wondering, with regard to approval. Is this whole thing gonna be approved before we start to build?
Yes, that they're not exactly sure when to start because it's got to be approved through ORIS.
Horace, yeah. Yes, Janet.
But Amber and I have been reminded to these every 2-week updates, please.
I'll ask.
Anyways, that's the report on that. I guess I can talk about other things. I have a lot more to say about budget items, a lot more.
We're talking executive session.
At the end of the session, because you've got some resolutions on here that really should not be given the light of day. We are so not ready to move this forward, in my mind, and you all should agree with me because there's some serious items, and I've got some research and things to share. I asked you to look into things, and the stuff we asked to look into the other night. And tonight we get handed a preliminary budget that doesn't take that into account. What, are you kidding me? 2 things were addressed, which actually increase the amount we have to take out our reserves. Just short of $1 million of our reserve funds, people, to try and make this budget balance without raising your taxes. So, smoke and mirrors. I don't like it. And we have some opportunities to shave off some of this money that's spending. That makes sense, common sense.
We're going to talk about it in executive session.
There's that, but there's also parts of that in which I asked you to look into about the cost of the health insurance. Thank you for raising it up again, because I've been giving that so much
We're gonna
thought.
talk about that in executive session.
The health insurance, you know about it? You already had a meeting?
No, this is more here.
Okay,
If it's not regarding potential employment and things that affect employment, that executive session wouldn't be, those topics would not be able to be discussed in executive session.
Thank you. So I'll keep going. Because I did, you know, I mess around. So I thank my husband for cooking dinner, because I don't know, I would be eating hot dogs or something, because there's just no time, and I stayed for days. But with regard to, and why it's so important to pay attention, and I know you don't want to hear it, and you're getting edgy here, but when I look at the cost of the health insurance and our offerings to our full-time employees and elected officials, if we were to eliminate the Cadillac plan, just do that, just eliminate that, we'd save over $45,000. Bingo, just like that. And I'm saying, even if you were paying 90%, like you're doing now for people currently on board, eliminate that option, $45,000 to the bottom line of this town. We cannot ignore that. I did that today. You want to see my numbers? Easy peasy. Easy peasy math. This is not rocket science. So I see this, and I, sitting here in 5 minutes before we started, I pulled up the preliminary or the tentative budget, comparing it with the preliminary budget, and as I said, nothing has changed, and nothing was taken into account that we questioned the other night in earnest. And it completely ignored, and then you put this official document, you accept this official document, and you want to just like, okay, we're moving on, people. I mean, seriously, take it right off the agenda. Let's go right to executive session. We are done. Because we cannot seriously have this on the agenda. Resolution to authorize the property tax excess, to talk about accepting this preliminary budget. I mean, I was shocked when I said, this has got to be a joke. This has got to be a typo when I got this agenda. And we got the preliminary budget walking in here tonight. And I see nothing's changed, except that we actually have to take more money out of our unappropriated fund balance. And that is, how could you, so you listen to two things, you reduce the revenue side for two little pieces. I found where you did that, but nothing else has changed. Guys, I did that in 5 minutes. And I saw nothing else of significance, nothing, absolutely nothing, zero was taken into consideration. And I was just like, we work so hard. We work so hard to think about what's appropriate, what's fair. And then it's like, well, yeah, thank you very much. Never mind, goodbye. And who gets to make that decision? I thought we're the town board.
Yep.
That's our decision to make. That doesn't come from anybody else. So tear this one up, because it's not acceptable. I think I'm,
okay,
for the moment. Thank you.
we'll talk. Councilman Brown?
Sorry.
I'm afraid to talk right now.
No, please,
Okay.
please.
And not quite as much as you had, but
These meetings.
yeah, no, I
Don't take credit. for
yeah,
going.
attended the what was it, residential code on the 30th, and then we also did the budget meeting on Monday, and both meetings there was quite a bit of discussion, so.
Sure.
Annette, you have anything?
So I district public hearing on their budget is set for October 21st. Full tax collection went into the town clerk's office on Friday, October 31st. But will continue as the Monroe County Treasurer with valid postmark through November 18th for your second and third payments.
Okay. Kevin? I attended the Fall Festival. It seemed to go very well. And both the workshops. Met with a group of residents on Middle Road with a drainage problem. Met with Todd from Invenergy. And I received a letter from the DEC. They're seeking town approval for New York State Department of Environmental Conservation to proceed with a possible acquisition of two tax parcels located on West Henrietta Road, totaling 47 acres of land for the addition to the Rush Oaks opening unique area. So it's something we need to think about, maybe vote on in the next meeting.
Does that require town approval because you're taking why?
I think they just want our blessing. I think the guy can sell it to the DEC whether we want.
Oh, okay, that's what I'm wondering.
They just like, well, we could probably do it tonight. We could make a motion to, if we're in favor of allowing that to happen. That's what they're looking for.
Just do it at the next meeting.
Do it next time. Okay.
Maybe you could forward a copy of the letter and we could
Sure.
digest that.
Okay. The resolution to authorize tax cap levy in excess, we're not doing that. Discussion of the maximum income eligibility, Amy, for senior citizens.
What I already emailed to you.
Thank you.
Have a.
Thank you.
So I did an analysis of the option to include IRA distributions as income as you requested, just an analysis of that along with the existing analysis that I already did for changing the town's current income limit to 44,400, which is what the school limit is, and also to 58,400, which is what the county limit currently is. So basically the last page has the results. Which basically is, it seems that changing to the option of including the IRA distributions as income for the senior and the disability exemption would likely offset almost completely the impact of changing the income limit up to 58,400. So this would sort of mean that there might be a kind of no effect to the rest of the residents were we to change the income limit up to 58,400 and include those IRA distributions. Now, we'll say that with one caveat. I have only been able to use the updated school tax rate. The tax rates that I had to use for the town, the county, were the old tax rates. So these savings might be a little inflated. It's hard to know exactly how low those tax rates are going to go. So these changes might be slightly different, but you have, you know, a difference of, for the county, it's $7.53 is what was calculated per the remaining residents. For the town taxes, it's down 75 cents for those IRA distributions. And then for the school option, it's down, or it would be down $9.50. So those negatives do offset that $11.07 increase if we were to raise the income limit to 58,400. I do think we probably have plenty of room in those three numbers, those three negative numbers, to almost completely offset that, even with the difference in the tax rate, which we don't know what it's going to be. So I also wanted to look at how does that impact the people that already have the exemption. So with the income calculation change, hold on a second. So what I figured out was there would be 32 exemptions where changing the income calculation would not change their exemption at all. There are 11 exemptions that would go away completely as the household income is more than 58,000 when we are including those IRA distributions. And there are 16 households for which the exemption amount would decrease, meaning the percentage that they would save would decrease in some manner. With the income calculation change, their income is higher. However, it's not over the 58,400 limit. I would caution a bit only because this is hypothetical. These 16 households, there was no way for me to, so basically what I was doing is hypothetically inputting the input into my system, and it was calculating the percentages, but it doesn't have the higher income limit in there. So the 16 households where it's decreasing a little bit, it may not affect them as negatively as I can see, because I can't put in all the inputs exactly as it would be. RPS just doesn't allow me to do that. So they may not see quite as drastic of a decrease. I also looked at the households that are saving currently 50% on the town, the county, and the school. With this exemption, there was only one household that would see a change. Their school savings would go from 50% down to 35% if we included those IRA distributions. So that's what I have. Does anybody have any questions?
My biggest thing is which option is going to help the most people. The raising the income level to 58.4.
I believe that will help. That will help a lot. That will help a lot of people. It will help them save more on their, they will be saving on their town taxes where they're not saving quite as much on their town taxes. It's also more of a known amount of, okay, how many people do we already have on the exemption? Because we already know there's people that are under 58,400 because that's the county limit. So we know how many more exemptions are going to impact the town's taxes, because we already know those people who are on the exemption. Changing the other incomes, the Social Security, which I gave to you before, that's a wild card. We don't know how many more people would qualify if you're changing how the income is calculated in a way where you're basically giving people more savings. That could end up being, it's on a little bit unknown. But that was also a big change in the taxes. I don't have that information in front of me, but that was a big increase. I don't remember what that was.
I apologize, but can you explain that piece having to do with Social Security? You're talking about the full amount or the reduced amount for the tax return?
So right now we're using the full amount as opposed to just what it's being reduced by on the taxes.
Okay.
We are actually, so all of their Social Security income is being considered. There is a way where you can only consider a portion of it. But that did have a much bigger effect on the taxes for everybody else, especially in the school. That was what was really, it wasn't a big impact with the town taxes, but with the school taxes, it made a big difference. I think it was like over $50 per household. Change, if I remember
For
correctly.
everybody else.
Yeah.
I don't know what we need to do.
I mean, I think you-
personally like increasing the
Limited.
income limit to the 58,400.
Yeah.
That's what
I
I believe
think
you should do.
I think originally when we discussed this in April, the proposal was to go to 58.4. We just wanted, I think we wanted to determine whether or not the social, to making a change to social security or making a change to include the IRA income would have a larger beneficial impact to our residents. I think that's at least where the kind of the conversation started. So I don't think, no matter what you guys want to do, I think we should repost that, propose what it's going to look like, that local law change, so that folks can see it one last time. See if there's any other comments before we take any action,
So what would we post?
we did a proposal of a law to show the change to the, so that the income level was changed to the 58.4. That was the original, that was the original.
Can we do one, I guess. I'm also in favor of including IRA distributions in the
If we're gonna-
calculating.
If we're gonna do that, we definitely have to repost, because that wasn't the original, so we should show what's being changed, make sure folks have a chance to look at that.
Okay.
That's all I was saying, is whatever direction the board wants to go, we're just gonna repost that proposed, local law study, and see what.
Yep.
I'm fine with just doing it at the 58.4 without the IRA distributions personally, but that's my feeling.
That's the way I was leaning also.
And why? Why would you not include IRA distributions? If people don't have to include their pensions. I mean, they do include their pensions. I mean, I rephrase that. To my knowledge, you're counting pensions. You are,
Yes.
not, I don't understand that.
How does that affect the other taxpayers?
Well, including IRA distributions is going to, it's gonna take down the number of people that are on the exemption. So it's gonna help. It's gonna offset the increase of 58,000 up to 58,400. It's almost gonna completely offset that, I think. That's my best estimate based on the tax rates as they are right now. Is that including that IRA money that people are receiving, that they do have to live on, that they do have to pay their taxes with, would offset changing the income limit to 58,400.
I mean, it just seems to me if people, have a pension and not IRAs, there could be limited, but yet someone who has identical funds, cash available, someone's going to get a reduction, this one's not. That to me is not fair. But you're getting retirement money, you're living on retirement money, and you either get a pension or you're taking the IRA money that you rolled over from your 401k when you're retired. And so you're getting hopefully one or the other. And some people just get Social Security and they're going to be fine no matter what we do, probably. Although, not everybody, because if, you could have people getting Social Security in excess of these amounts. But a fair amount of people. At any rate, that's not going to change those people, but to me, it just seems grossly unfair. Just unfair to the population, the people who, are getting pensions versus IRAs. It's just, it makes no common sense to me whatsoever.
I do agree with you, Chief,
Thank you.
but it's not up to me, so.
Is there a dollar value to the IRA distribution? Or is it just showing that they're collecting money from an IRA?
So we are inputting, lines from their federal tax return to calculate the income. So yes, it's a specific number.
So if they exhaust their IRA, because there's not much in it in 5 years, they gotta wait for that following year to show that they're only bringing in the social security.
Correct. So we're running a year behind. So right now we're collecting 2024 income for the 2026 roll. Yep.
That's probably the way we should go.
I think you gotta include the IRA myself.
You should
Still-
include it.
Still money made. That's my opinion.
It is money.
If
Yeah.
someone exhausted their IRA and they were looking for the exemption, but they weren't able to qualify because you haven't received their tax returns, is there something that you could do to help them?
I don't understand the question.
If
So,
someone exhausted their IRA
right,
and now they're solely living on social security,
right.
but there's essentially a backlog because you're going off of past tax returns.
Correct.
How do they, but now they're concerned about, paying their taxes.
There's nothing we can do. That's the law is we're looking at the previous year. So the taxable status date and when the exemptions are due is March 1st.
Mhm.
Taxes, the tax deadline isn't until April 15th. So we can't say we need to we need your current tax return because some people haven't finished their tax return by the date that the exemption is actually due. And the state has said you need to use that prior income year. So we're collecting the proper year. It's a state law, which year we have to collect, and you're right. But it's the same for everybody. If you were to exhaust any, of your income, you have to sort of work it out for that year until we can look at that income. But those people would then be able to, qualify for the exemption once their income qualifies them. They would just have to come and apply. Yeah. All that with me?
I believe so.
Yes.
I think so.
Okay.
What's our plan for moving us along?
Yeah, so if we were gonna move along with Gene's recommendation, would we need a,
So we're gonna take the existing proposal, go to 58.4, but we're also gonna modify the law to add IRAs as part of a residence income.
what's the board think?
I already said what I
You-
thought,
you just
but.
want- You just wanted to raise the income.
But I guess we can post it like that and I guess we'll vote on it.
I'll make that change to the local
So-
law and submit it so that everybody. can take a look at
Raising
it,
to 58.4 and including the IRA. Okay, all right.
And then we can send it
We-
out in advance of the meeting. So that this happens, then the public can comment on it, the public hearing is still open. So we close it after that, you get feedback comes back in. And then. you
Okay.
guys take
So
that
we can
into
get
executive.
feedback from on that.
Yep.
Thank you very much.
On the budget stuff, if we're gonna we're gonna talk about insurance for employees. We need to do that in a public meeting.
Yes.
Janet had run some numbers. We bring her in and we can discuss that.
I think that would be the best way to do it. Like
Yeah.
Gene said, we just
Yeah,
got this
yeah,
permit as
yeah.
we sat down tonight. So
Yeah.
I agree with Gene on that, in that respect, that
Yep.
we haven't had time to review anything, really.
I'll go grab Janet's. So you ran some numbers on insurance? You wanna step up to the podium?
So we were given multiple plans from Brown. And so I just started running one of the plans that was closest. So currently we have platinum plans. So if we went to the gold, this is just quick numbers. I tried to figure out what it would cost an average employee to change plans. But there's a lot of variables in there because it depends on how much they go to hospital and items like that. Trying to see. But I also ran numbers for the savings and the difference. So currently, this is what you guys got before. And so then this is what the gold package here, and then it shows you the difference. So by just switching the platinum plans to a gold package, you're looking at a savings about 68,000, I think it says on there.
Yeah, the first paper you gave us,
So that goes over the difference between the primary care physician costs, like if you're looking at it, most of them pay between 50 and 30 now, they would pay. Which would be the. Sorry, I'm looking for my correct page. So yeah, so average of platinum 6 plan, which is the majority of what people are on, they cost them $30 every time they go to the primary care, to go to 40. And so then I just did the average of, somebody 55, how many times do they normally go to a doctor a year? Is 4 times, so 4 times an extra $10 would cost $40. Now that's for single. We also have to think of, some employees have family plans, stuff like that. So really I did it more on the single, and then we'd have to times it by 2 or times it by 3 or 4. The specialist right now costs everybody $50 every time they go. With the gold plan, it would be $70 a visit. Same with that, an average of 4 times a year. And these averages, I just put into ChatGPT, and that's kind of where I got my. So inpatient hospital, it says normally people do once every 8 years. It says, the platinum 6 right now only costs somebody $750. It would go to 80%. I don't have a clue of what an in-hospital stay an average would be. And so we'd have to calculate that out. I hadn't gotten that far. Prescription drugs right now are $5, 35 or 70. It would go to $10, 45, 90. Telemedicine would go from 50 to 70. In-network deductible, right now they don't have a deductible at all. They would then have a deductible. So we would have to calculate that in as well. And that's why I was trying to see if they even hit the deductible half the time, or if this just would come out of their, out of their pocket. Co-insurance, it goes from 0 to 20%. And I don't know enough about that. In-network out of pocket. So there's a maximum of $6,550 to $13,000 right now. It would go to from $8,250 to $16,000 a year. But per individual, it would be, the max would go to $8,250. So each individual person on their plan up to the 16,500 total. Out of network goes from 80% to 60%. ER visit would go up $50 and urgent care would go up $20 a visit.
I have to speak up. If ChatGPT is being used as a reference for our finance data, and it's not, that is not acceptable. You don't know anything about ChatGPT, I'd be happy to educate folks about it. I have a lot of experience with generative AI, artificial intelligence. It is an unreliable resource that hallucinates information. It cannot, should not, as a primary research, that will not represent accurate data. Putting it out there for anybody who's not informed, who's not familiar with that tool, the helpful tool in other contexts, but should not be used in primary research.
And I have to speak up because I worked in healthcare now since 1975. I have a lot of experience with insurance companies. Lots specifically like South, the numbers that you're getting from that, you're using ChatGPT for numbers are incorrect. You have to go to the insurer, you have to negotiate the contract with them. You have to say that's the only one you're gonna use. And then you have to say, what are the best rates you can give us? You can't just accept what they tell you. You have to go negotiate with them. You have the power of a group, a large group of people in your municipality and the state. And their numbers will be different than what she's talking, because really, all the tier 1 drugs are usually free and
Do it next time.
the total amount.
We need to
like,
kill this and do it next
if you
meeting.
get, like, you get sick and use that whole $65,000, there's ways that you
That's,
get that change. So.
thank you, but thank you.
Right, we deal with an insurance broker, so these are what our insurance broker gave us. And that's who we go
You
through.
use ChatGPT just for
The average of what a
the average, how many
55-year-old
times
person
went to.
go to the emergency room, to the visits, because, I mean, personally, I don't remember the last time I went to the doctor's office, but I'm also not 55, so.
These are our active employees, right?
Yes.
What's on the other page?
What other
Retired
page?
ones. What's on our retired? Where we go-
So we didn't get any retired, because they're in a consortium. So we didn't get any of the changes for them. So we last year signed on to a consortium, which gave us the purchasing power of the whole Western New York State, the whole Figure Lakes area. So they are getting the best deal because it's a Medicaid plan. There's not multiple options.
Tell me on this calculation for the gold package. But the 68,000 is made up of. I was assuming when I was looking at the numbers that some people have a plan for a single. And some have a family.
Correct.
I don't know what other variations, because there were other variations in rates.
So
I don't know.
there's a 2-person plan, there's a single plan, there's family.
Okay,
So yeah, so I just went exactly with what they have, either a family or 2-person.
using the gold,
Yes,
okay.
And that resulted in $68,000 in savings.
Bingo. I don't know if that's the best thing, or if there's cheaper versions, what's, where does the gold package in the hierarchy of health insurance? I mean,
so
it's
obviously
crazy.
it's platinum, gold, and there's
So-
also different variations of gold, different variations of platinum.
So which did you pick?
I picked the gold 21,
Which is,
the second tier down, that's a gold. He gave us a couple different ones. I only had enough time to do the one for you guys.
so I guess I don't know what that means, how much would we save with the next level down? I don't know. And what would be,
Right, I tried to grab the one that was most closest to what they currently have.
but maybe that's we could do better for the town as a whole. And not hurt them too much. I don't think we're gonna hurt people. They're still getting really good coverage that the town is still paying 90% of. I mean, I think we should change that, but I'm just like, let's at least do the low hanging fruit and get rid of the Cadillac plan. You can't pay 50 grand for somebody. That's crazy. That's just. So. Where do we go? Should we look at the next, like what's available, pick, this is what the town is gonna offer. Because we certainly. $68,000 is nothing to, that is something to sneeze at.
Yep.
And to tell you the truth, a lot of these full-time employees are highway employees. And guess who is depleting their fund balance the most?
Sure.
The highway department.
Last year,
We are at a dangerous level, people.
they were high.
Yeah, because
Probably end
we
of next year, they'll be high.
bought all the equipment. And I have
They'll-
questions
they'll
about
build
other
it up.
things with our billing with the highway department, but this is a great start. I'd like to know if we could do better without hurting people too much.
I'm fine looking at different packages, but for new hires.
Oh, my God.
I know,
That's
that's what you
just
said
not
the
right.
last time, and I'm gonna stick to it. We're, I
You'd
am,
rather take care of friends and family than
I'm taking care of employees. To bring it up to friends and
who
family is
happen to be
ridiculous.
friends and family.
That's complete nonsense, Gene. Some of these people I just know from being employees here. I wouldn't say that they're friends. Some of them do happen to be family, but they're employees of the town of Rush. And I want to,
And
I
give
want
them
to
health
support the
insurance.
employees that we've had for, some of these people have been here for over 20 years. And this is what they were offered. And I think we should continue to give them what they've had. And any new hires after that, then we can present them with a new plan if they want to come on. But aside from that, I think that we honor what we hired these guys on for, and anyone after that, then we present them with a new plan. That's what I
And
think.
maybe the town board should forego, their salaries then to make it up. If you want to do that, keep the employees. Don't take a salary next year.
You want me not to take one?
Yeah.
Sure, fine,
I was gonna bring that up too.
fine. If that's what will make you happy,
It's not
fine.
making me happy. I'm not on the board next.
To be honest with you, Gene, when I ran for this office 4 years ago, until the organizational meeting, when we got all our information, I didn't even know I got paid for it.
Yeah.
So to bring that up is complete crap too. This is how I feel. If I was at a school where I wasn't related to anybody and they wanted to restructure somebody's benefits, I would have the same feeling. For you to be here, oh, your friends and family, that's crap, and I'm sick of it. And I don't need to get paid. If we want to restructure that in the organization, then so be it.
You know
But
what?
I'm
If you
I'm
go
sick of this crap.
Anywhere else, anywhere, every year, the employers put out a package. This is what we're offering this year. You don't get grandfathered in anywhere.
I don't know that
anywhere.
it's every year. My wife has been in a company for a while, and I'm pretty sure every year she doesn't come and say, well, they're restructuring our whole healthcare system
Well,
this year. I'm just saying, it's
I'm
not
just saying
every
you
company,
get a
it's not every
choice.
year.
You
And
get a choice.
we're not private, and we're, as a
Yeah,
board, we can make,
exactly.
I'm one person. So that's how I feel.
We're
And,
not private. We're asking the people of the town of Rush
and
to pay
if,
this money.
okay, and we were all elected. So
Yep.
if they don't like what I just said, well, they can make a choice in November then. So, whatever. I don't care. I'm only one person on this board.
Absolutely unsustainable
And
it's
I'm saying that,
irresponsible with insurance going up 15, 20, 25%. I don't know. It's all over the board when I look at our budget, what we're budgeting. In some departments, it's up 15, in other departments, up 24%. So yeah, what is the real increase? for next year?
Oh, for the health insurance, we got the notice of 25%.
25%. How is that sustainable to keep paying a burden on the town to pick up 90% of that 25% increase, all on the town? Our fund balance is going down, 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 down.
It is
And
not
we
gone.
haven't reserved anything to pay you. We talk about the salt barn, you know, that it's gonna be $500,000. We have no money for that.
No, no.
We have no money for that.
No, it-
Or you look at the, when you pointed out, thank you, Dan, when you went over to the highway garage in the disrepair that's over there. What are we doing we have to replace the windows here? We've got it. You can see through the walls at the town highway garage. You pointed that
I
out.
sure did. I got pictures of it.
And thank you, because you alerted all of us to the fact that we have to take care of town property. So if you think you want to pay the 25%, it's not going to go down every year. If anything, subsidies are going away. All our insurance, I don't know, anybody here who is on Social Security and Medicare, well, guess what? Your plans are changing next year and get ready to pay more. So, we all have to, it's an increasing burden on everybody, and we have to cut where we have to cut. And you go to any employer, private employer, and they're going to tell you, here's what we're offering this year. Boom. We try to do the best, but there's the best we can offer you. And, let's get with what everybody else has to do. And bite the bullet here, because it's unsustainable to think about absorbing that increase. And if you think it's okay, then you go out, knock on the doors, and sorry, people, but this handful of people, we want to give benefits so that their payroll package is in excess of 100,000. Sorry, but you got to kick in maybe not 2% more taxes, maybe 4, maybe 6% more to make this affordable for these people. So let's tell everybody else they got to pay more taxes, because right now you're balancing this year's budget. The plug to this year's budget, people, to keep it at 2% is to take $1 million out of the unappropriated fund balance. $1 million. That's not chump change. Oh my God. That's how we're keeping it 2%. It's not magic. It's a plug. I know in accounting that's an evil word, but it's what it is. It's just like, what do we need to keep it at that? You do the reverse math. Oh, bingo, we need $1 million out of this fund. Let's take it so it looks good. What's the number? That's the number. You take it out and I'm just saying, I'm looking for ways to keep it at the 2%. Yeah, let's keep it at 2% and do the best we can. But we've got to look for places within this town budget to cut costs.
And we spent $80,000 last year to match a grant for the 1911 house. And we're gonna have to pay, as Derek said at the budget meeting, we're gonna have to pay the heating bills for a house that we can only use the downstairs because it's not HDA compliant to get upstairs. We have this massive house that we're gonna have to pay all this up. Maybe that should have been something that was thought about as we were going through that process. I mean, that's a lot of money, and it's gonna continue to be a lot of money. It's not a one-time thing. And there were options presented that would have been feasible, and they were shut down on that stuff. And we're talking about people that provide a service to this town and everybody in this town. And that's where you want to chop them off at the knees. But that was trying to do
I'm
that.
not eliminating healthcare.
You're taking stuff away from them.
Not much.
Okay.
They're getting a benefit that no one else gets. Nobody. And I dare.
So we're the only place that's using this plan.
And paying 90% of it.
Okay.
Make them pay more then. You want to keep that plan? Have them pay more into it. You
I'm
don't
just
wanna do
saying, we're
that
talking
either.
about where to make cuts and what to do and how to do things and what, yeah, but let's look at where some of this other money is going. It's easy to point at this stuff. It's easy to forget about that other stuff.
Please. I think we have more work to do on the budget. How are we gonna schedule that?
Yeah, under this gold plan, we're still paying 80% of their insurance.
90,
We're still paying
90%
90.
under the gold plan. They
correct.
got the platinum now.
Yeah,
So really, they're not, they gotta put a little bit more out to stay healthy.
little bit.
Back when Billy Dishers and I was on the town board, we went through the same thing, and that's when we took them from 100% to 80 or 90, whatever it was.
It's 90.
We took it down because of the same reason, and now the numbers are going ballistic.
Yeah,
Even
at
worse.
it increasing at 20.
So I think it's, you're kind of both right. We're really not taking anything away. They're just gonna have to put, we're still paying the 90%, but it's gonna be a different plan, and they gotta pay a little bit more out of their own pocket. Stay healthy, it's not a problem. Right? I wish I could get this in my company, but my company does the exact same thing. Every year, we gotta go back there, sit there and go through the whole process and pick and choose what you want. I can't get, I wish I could get this. So I think that while we're still offering, we're gonna pay the 90%. But this is the plan you can pick from. And it's really not, you look at it, it's, yeah, a little bit more co-pay in the network, a little bit more here, your prescription. You know, I really have a hard time justifying the little bit of difference here if you're healthy. You know, and even if you get sick, it's not that huge a difference. And the town's still paying for it. That's my opinion.
I agree.
There,
Would Brown be able to come and explain the difference?
Yes.
What's our cutoff to make this affect this budget?
I think we needed the preliminary for the, sorry, the special budget needs to be approved by the 30th of this.
But with regard to, I know that for health insurance, open enrollment stuff, we have
That's a
time to
January
choose,
1.
we have time to affect this, to affect our budget for next year to cut our costs. Thank you.
Brown,
Yeah,
Brown,
we would need to do it by the end of the month, because we are, per our handbook, supposed to give everybody 60 days.
So,
would Brown and Brown do a night meeting if we were to have another workshop to talk about this?
That I don't know. We've never asked that of them, so I don't even know if they do that. I'd have to ask.
If.
I'll come in Monday night. I don't have a holiday off.
We'd have to notice the meeting.
We've done things.
5 days.
5 days, I mean, it get to the point where it's going to be a little bit special circumstances because we're running up against the
Yeah.
deadline, so. I think we need to. If we have to call a special meeting there, you do a special meeting instead of a workshop. Then you can do sooner, you can do shorter. I'm just thinking. Just talk through.
Thank you, because we have done that in the past.
Yeah, schedule what's the availability of board members for one special meeting next Tuesday during the day, when we get Brown and Brown here, if we get there during the day on Tuesday.
I can be flexible.
I might have to Zoom, but we'll see.
I'm available Monday, Tuesday.
Want to try to set it up for Tuesday during the day sometime?
Okay.
Because Brown and Brown won't come probably.
If we do it on Tuesday and have it as a special meeting,
Yeah.
But can we find out first thing tomorrow morning about Brown and Brown and still have time to figure out if we can do it at night? But we still have to schedule it now. Still have to,
Well, we had scheduled time, a date and time. If we don't have time. We have to schedule the public, because a board member can call a special meeting, so. If we have to schedule a special meeting, we can do that tomorrow, once we know what Brown and Brown. And get it noticed.
why don't we do that then? Check with them and see if we can get availability at night and then we can schedule. That works.
Do that.
Thank you for getting this started. Do we need to have a resolution to schedule a special meeting?
No, we can, well, that will come. We'll go to the chamber. We'll have somebody call us as supervisor for a special meeting, and then we'll get the notice out in the paper and get it published on the website, so that notice will allow the public, but you don't need a resolution to do it, because it's special circumstance, so it's not the normal procedure.
Thank you.
We'll do that.
Can, this other question concerning budget. In the highway department, and I know. I've been told that there's a formula developed for charging. Costs back to the state and the county.
Yep.
For work that we do on those roads. And I'm been assured it covers everything. But what I don't see in there, and I'm, this starts working on me when I take time looking at what's going in the revenue sources, I'm sorry, for the highway department. They get reimbursed, the highway fund gets reimbursed, but and this bothered me for a long time, the town general fund is responsible for buildings, the real estate,
Yes.
including the highway
Yep.
buildings. And the town does not get reimbursed a nickel. Am I right?
You're right.
Do we, in the formula for charging back the state and the county for the work, does that include any kind of a service charge? Because we're not getting anything on wear and tear of buildings. I think they factor in there something for equipment
Yes.
and labor.
Benefits and labor.
Right. But nothing for property, plant and equipment as a whole.
No.
As part of that formula. So we have a highway garage that's falling apart and our salt barn, which we're really worried about, falling down. But yes, we use that for the benefit and we don't build in a factor to get reimbursed for that. We need to change our formula.
That's not our formula.
Yeah, I think that rate's set by,
It's
DJ
set-
said it's set by,
set by the county
It's what
and
they're
the state.
really worried, well, they can pay us back for it, that's.
Well,
Done
then
by
why
the-
should we do this? We're losing money.
Lose-
Well,
For plowing roads.
No,
And
but
fixing roads.
we're doing stuff for other municipalities. And that causes us to have, I believe, more employees, isn't that so? If we didn't have those contracts, how many employees would we need for the town of
I
Rush?
think we still need those employees for snow removal and stuff like that. in
100% of the
emergency.
employees for the town of Rush.
I believe so.
But yet we're still with those same employees doing all the roads that don't belong to the town of Rush.
Well, because they're in the town of Rush, they need to plow those roads. to
I'm
do
just
town of Ru-
asking.
But I'm just
trying
saying,
to
I mean,
Understand.
so 251, 15A and
Yeah.
15 are all state roads.
yes,
And because they fall in the town of Rush is responsible for plowing them. And that's how they get reimbursed from the state.
Okay,
Same with the county.
County roads, same thing.
Yes.
West Rush Road, Rush Henrietta Town Line Road,
East River.
East River, they're all county roads.
but
And they use those
Kaiser.
roads to get to the other town roads, so you would pick up your plow, drive over. You're still going down the same road.
so what do
I
other
understand.
towns do? I don't understand because not other towns do this. So
Same-
Everybody does. In town of Henrietta, they
Some of the smaller towns don't, and they have the states come in and plow.
So they have different plow crews.
The
that-
state does for like some of the very small towns, I think the state comes in and does stuff, but like for any towns like in Monroe County, it's all It's all the same. They all get reimbursed for doing state and county roads.
And does the town of Rush do other roads that are not within the town of Rush?
Yes,
Yes.
Not for plowing.
not for
What,
for
what do we
plowing.
do?
repairs.
We do.
Repairs.
But on
Those are the
county
ones we get
roads.
reimbursed.
Yeah.
So, and then we get reimbursed. So that's my question. So my question, would we have as many employees if we didn't take on that extra work? Because we keep getting assured, well, we get reimbursed.
I think you try to fine line though, because if you can't have someone on call plowing the roads, DOT law, X amount of hours, you have to send them home. And you have to have the ability to have 2 shifts to plow the roads. So you're gonna need 2 people per that truck. And right now, that's what they're doing. They're 1 person plowing anyways.
But so then,
And when they do work for the county or when they work for the state, they cover the full cost of that person. So when they're doing the road work, there's not costing the town of Rush a dime, basically. Or it's our truck, our equipment that we bought for the highway department that they're using to get reimbursed, but we get nothing back out of it.
but it's my
That's the system.
understanding in having conversations in the past. And I apologize if maybe I didn't understand it right, but it was my understanding that not all towns do what we do. Because they don't want to, they don't want to deal with it. I was told that,
Deal what? I missed something.
working with the town, the county, and they don't do what we do, offer the services to outside the town.
We work for other towns and other towns work for us also. When they
But
just-
it's on county work, like.
Yes, it's on
Like the
county.
town of Rush does a lot of work with town of Mendon, town of Wheatland, but that doesn't mean they might work in partnership, but they might be in the town of Pittsburgh or town of Henrietta. They've done a lot of work around there. Town of Wheatland.
Right, and municipality agreements to work back and forth.
So my intent was not to get off tangent and talk about the number of employees in the highway garage. My thought process was like, how come we're not getting paid anything for the buildings that everything is housed in? We don't, and we don't have the money to fix them.
Way the state set it up, the system,
Well, can't that
there's a
be
recovery
negotiated?
system for it.
Can't we do something? Have we
I-
ever asked?
I know the reimbursement based on the state tells you what you're gonna get reimbursed for, and it's off of like a 3-year average of snowfall and usage.
So,
And remember, because that's, again, remember the resolution we okayed back
yeah,
a month ago? That was because we went over the average.
I just want to make sure that we're not missing anything, because I don't know, I've never tested the calculation, have you?
No.
I don't think anybody here has.
No.
How do we know it's fair? That we're capturing, that we're all in, that we're not losing money? I've been told that, but I've never tested the calculation, never audited it.
Well, in theory, if you were in business for yourself, you buy yourself an excavator, $100,000. Right, and then for every hour that machine works, you gotta put money away to replace it, to
Yes,
fix it,
yes,
and profit.
yes,
And then your operator,
yes.
fuel, servicing.
I think that
And
this would be the best question, the best person to answer this question would be the highway superintendent.
Yeah,
Right, I was gonna say, when they bill it out, they
And-
bill it out how many hours per each
Right,
person, and then they see the check that comes back, so they're billing them in exactly what they should be. getting.
And
yeah, but the
But-
rate,
yes,
test the rate.
DJ has that calculation. I can't speak to the numbers. I don't know exactly what they are. But there is a calculation where he does have it figured out that it costs me X amount of dollars per hour.
And is that recalculated every year when we
Yes, it is,
increase?
because I have to resend the benefits every year.
Okay,
Yes.
okay, good.
So
Anyway,
but to have a more detailed answer on that, I think we need to have DJ here to answer those questions. Cause he's the one that works with them every day.
and give, the benefit of the doubt, say that it is. I still have a problem with us not getting paid a percent of something that factors in the building. the grounds, the highway grounds over there, because the town is paying 100%. And not getting reimbursed for any of it, but we're not building that into our overhead that we're charging out. Do you understand?
Maybe the town, the county.
We're businessmen, you
or the state
understand.
doesn't care if you park your truck inside.
I don't know. I'm just asking to look at that.
I mean-
this piece of equipment would have to have shelter if that's what we want to do.
Even if we used it sparingly.
I'm looking to raise money
Is,
in a fair way, that's all. I'm looking for.
I just don't
opportunity.
know if there's, how any other municipalities work that out. I don't know if, I'm not sure what the other towns are and how they have their deal structured with their DPW.
I'm looking for an opportunity here.
Well, most towns in the group will be doing. I mean, some towns you have, are very busy, so they are hiring other smaller towns who.
No, to answer Gene's question, as far as, are a lot of other towns structured where the town owns the ground and the buildings? Is that how all other towns are structured? And then the highway department owns equipment?
Their highway departments are housed municipally.
So what's their, how is that structured with them as far as, is there rental or is it just, is it exactly how we're doing it right now? Does anyone?
My experience is typically how you guys are structured, where the municipality maintains the facilities and the actual service work done, to extent the agreement to take care of state or county property, that gets reimbursed, but the actual underlying infrastructure and improvement, there is no allocation for that. That's an expense of municipality.
And buildings is always under general.
That's,
That's.
I was just curious if all other towns were
I mean, I'm certainly
Most-
saying all, just saying that
majority or.
in my experience,
Here, okay.
I mean, really it comes down to the same comparison to the fire district. They own the building, they own the property, they tax the town. Where the highway department is, it's our left arm out there. So we own the building, we own the property, they do the service work for us. We buy the equipment and maintain the buildings. But if
Well,
you're
they
a
buy the
district-
equipment.
Hmm?
They buy the equipment.
Yeah, we pay
I-
for it.
Well, but I mean, it comes out of highway funds.
Right. But for the fire district, they tax the people and then they buy the fire department, they maintain the buildings they're on. They're out there by themselves. So I think that's kind of comparison you gotta kind of look at it. We're responsible for them.
The highway
They do
department
it
has their own
yeah.
budget, but it's part of the town budget.
Looking for a way to generate some funds here because we're running out of money in the highway fund.
I
And
mean,
the town, and it's always been the reverse, like last year we had the reverse.
Yeah, they were.
We had to spend a
They
lot of
lost.
money here. And, it's just like, it's some way, because we set where the money goes. We collect the money, but I think the town decides where it's going. I think we have a
Yeah.
discretion over that. So if we think it's too much in one fund, we can pull it over the other one. I was given some flack for even raising that question last year, but I think I'm right. I don't know. I think those were my vague questions, other than ones that we'll reserve for executive session. Thank you.
Relative to this special meeting, supervisor can call a special meeting with 2 days notice, so. As long as all the board members are in. So I'm hearing that you're on board with it, so once we find out when the
Well, we can-
consultant's available. We can generate a notice in the special meeting and then we can date the time, it just be 2 days to do it, so we shooting for Tuesday, certainly have. That done. But I would do it as a special meeting as opposed to a workshop because the.
Okay.
Okay,
Okay,
all right.
that it'll serve the purpose, and then they can
It's-
give us all the
it's-
plans.
Yeah, it doesn't really make a difference, just. That's but, so it's maybe it's having.
So the last two new business items we're gonna put off for a special, or for a special meeting. That's all we have for this evening, and we're going to move into executive session.
And you're not anticipating taking any action outside of executive session.
We're not gonna take any action outside.
So when you come out of executive session, it's simply closing the meeting.
Yes.
That was just for everybody's benefit. So
So make a motion, move into executive session.
I'll second that.
Right.
Aye.
Supervisor Williver,
Aye.
Riley,
Aye.
There. I needed some, we don't know that.
No, we're discuss personnel matters.
Are we staying in here?
And I think it should be just the board. Just the board.
John's here to talk about his.
And then he's gotta leave.
Okay.
We need to be able to talk. And
Okay.
that's why we need to do this.
Okay.
What, John, we want to discuss John first? And
Yes. Yep.
Then you can take off.
Thanks, sir.
We're up a Zoom meeting.
No, we're stop recording, right?
Yes, we're gonna stop recording.
And then just restart it.